Hi, this is Jay Farner, CEO of Rocket Mortgage. Making the right financial decisions has never been more important. We can help guide you to those right decisions now, when they matter most. Mortgage rates are near historic lows, so when you call 833-8-ROCKET or visit us at rocketmortgage.com to start your refinance, you'll be well on your way to saving money every month. The rate today on our 30-year fixed-rate mortgage is 3.375%, APR 3.59%. Right now could be a great time for you to take some positive financial steps forward with a cash-out refinance from Rocket Mortgage, which could give you the boost that you're looking for. In addition, we may be able to help you refinance with little or no out-of-pocket costs. At Rocket Mortgage, we're committed to every client, every time, no exceptions, no excuses, giving you the best mortgage experience. Call us today at 833-8-ROCKET or go to rocketmortgage.com to learn more.
Rates subject to change. Pay 1.875% fee to receive this discounted rate. Call for cost information and conditions. Equal housing lender. Licensed in all 50 states. NMLS number 3030.
Good morning, America. This is the Cats Roundtable. John Catsimatidis here, Sunday morning. What's happening in America? Well, we have riots, but we can't forget about the virus. And with us this morning is Dr. Anthony Fauci, the Director of Allergy and Infectious Diseases at the National Institute of Health. Good morning, Dr. Fauci. How are you this morning?
I'm fine, John. How you doing?
I am doing well. I tested negative twice for the virus, so I'm doing well.
That's good.
How are you doing?
I'm fine. You know, we're a lot happening, a lot to do, running a little bit on fumes, but we're fine. We're doing fine.
Can you give us an update of what's going on?
Yeah, you know, it's a complicated issue. Things in general are going better, John. I mean, in general, if you look at the country as a whole, in many areas we're starting to see not only a flattening out, but a diminution of cases. The number of deaths continue to come down. Some places, unfortunately, are having increases in infection, hopefully with good and adequate identification, isolation, and contact tracing, that we'll be able to get a handle on that and prevent them from becoming really resurgences of infection. But when you get places like New York City, you know, they had it really, really bad, but they're doing much, much better right now. New Orleans had got hit pretty badly, doing much, much better right now. So although things are still active, I mean, obviously we're still in the middle of an outbreak, we're cautiously optimistic that things are going in the right direction. Hopefully that doesn't change.
The one question a lot of Americans are asking, and I know we've been through hell the last 4, 5, 6 months, is do you feel betrayed by some of your friends in China? I know that you're probably friends for 10, 20 years. Do you feel betrayed? Do you think they didn't tell you everything?
Well, I don't feel betrayed by the people that are my friends, my scientific colleagues, that I've dealt with over, you know, more than 10, 20, 30 years, over the years with many of them. But I think the Chinese authorities that did not allow the scientists to speak out as openly and transparently as they could have really did a disservice, because in the beginning of the outbreak, they were claiming that this was just animal-to-human transmission, and there wasn't really any human-to-human transmission at all, and if so, it was very efficient. And they held that line for a few weeks. And then it became very clear when the scientists were able to talk about it that, in fact, there was human-to-human transmission that was really very efficient for at least a couple of weeks before it became clear that this was the case. So, yes, it's another example of the unfortunate situation of lack of transparency early on. Right now, I mean, it hopefully has changed a bit, but there was that period of time where we weren't getting, in a timely fashion, the accurate information.
And the World Health Organization, the WHO, what do you feel about them? It seems like they were under the thumb of the Chinese Communist Party.
I don't think I can comment about that because I don't know, John, but I can tell you that it's a complicated issue. I have had relations with the WHO for years. I have many colleagues who I've worked with over the years. I think that Dr. Tedros, the director of the WHO, the Director General, fundamentally is a good person who really cares about ending this outbreak. But the organization is an imperfect organization. There have been some flaws in it that have been some troublesome. Hopefully, that will get corrected and they'll get back on the right track. But I do still have interactions and collaborations with them.
Let's talk about the possible. We're trying to open up our cities, trying to open up our New York, and we need some kind of solution. First of all, a temporary solution. Of all the temporary possible drugs that are being touted, you see any promising ones that we could have in the next 30, 60, 90 days?
Yeah. Well, John, we terminated in the positive sense a clinical trial a few weeks ago on a drug called remdesivir, which was given to people who were hospitalized with lung disease, and we compared it to a placebo. It was the first large randomized placebo-controlled trial of a therapeutic intervention. And what it showed that remdesivir gave a modest 31% decrease in the time it took to recover. It was statistically quite significant, but it was a modest effect. We hope that in the coming months, with other drugs of the similar category, as well as other interventions that are going into clinical trial and that are in clinical trial, will prove to be beneficial. We don't know that yet, as you well know. You've got to do the clinical trial to prove it. Some of them, for example, like monoclonal antibodies, which are proteins that the body generally makes naturally to block the virus, you can manipulate that molecularly to produce large amounts. They have already started to go into clinical trial, and other companies will also put their products into clinical trial. There's convalescent plasma, namely drawing plasma from an individual who's recovered from infection and passively transfer that into someone who is sick or into someone in whom you want to prevent infection. And then there's hyperimmune globulin that is derived from the convalescent plasma. So there are at least a few, in fact several, therapeutic modalities that are now either in trial or will soon be going into trial, that we are hopeful that by the time we get into the fall, late fall, that we'll have some results that we might be able to use them as we get into the next season.
I think if we can get at least one or two of those approved, people will feel better. The vaccine is much further away, and there's several companies working on it. Right. What's your take on that?
Well, I am cautiously optimistic about. There are a number of candidates, 4 or 5 of which the U.S. government is involved to a greater or lesser degree in collaboration in the development of it, either basically or from a clinical trial standpoint. Several have gone into phase 1 study. We will be entering into at least one of those candidates into a phase 3 study in July, which means trying to determine if it's effective, if it really works. And we're hoping that by the time we get into the mid-late fall, we'll be able to get some data to indicate whether or not it works. If we are fortunate enough and there are no glitches or speed bumps on the way to this, that we may have a vaccine that we could be utilizing toward the very end of this year, December, and into January, February of 2021. This is aspirational. There's no guarantee, but at least there's the possibility and the indication that this might be able to be accomplished by that time.
Is there anybody in particular that you have more confidence in than others?
No, I think there are a number of candidates. Some are ahead of the others temporally. That does not mean that they will be better or that they will be more effective. My hope, John, is that there won't be just one winner in this trials of vaccine, but that several candidates from several companies will prove to be successful in being able to prevent infection and or disease. So I think when the people think about vaccines, they shouldn't think about it as a race of a single candidate getting to the goal line. What it is a process to hopefully get multiple candidates that turn out to be safe and effective, because we live in a big planet, in a big world here. There are, 6 to 7 billion people who would ultimately need a vaccine. So the more the merrier. the more vaccines that are proven to be effective, the better off we'll be, because we're going to be needing not hundreds of millions of doses, but billions of doses.
Understood. Have you seen any tapering off of the infections in the last 30 days or 20 days?
It depends on where you are. As I mention often, United States of America is a big country. We have many states, 50. We have territories. We have cities. We have towns. We have counties. And I think you should not look in a unidimensional way. You have to look at where you are. There are some regions of the country which are looking really good. Their infection rate was very low to begin with and remains low. There are others that had outbreaks, like New York and New Orleans, Chicago and Detroit, where the infection rate at one point was very high and is now coming down. Unfortunately, there are also some areas where the infections continue to go up. I think when you look at all of the country as a whole, namely putting everything together and getting the averages of it, certainly the deaths are clearly coming down. The hospitalizations are coming down. The cases are coming down, but less steeply. It's a slow decline of going in the right direction, but it is. I'd like to see it be a little bit more sharply declined. But in general, John, we're going in the right direction.
Doctor, one question. So many lives were lost. Everybody was saying, buy more ventilators, buy more ventilators. The death rate in some places was as high as 80% of people they put on ventilators.
Right.
What say you about this?
Well, when you're sick enough, John, I know this as a physician who's taken care of a lot of very sick patients in my career. When you have a very serious disease that requires intubation and ventilation, that is already a very, very serious disease. Certainly 80% mortality in people that go on ventilators is severe and higher, I believe, than the average of people in general for all diseases who go on to ventilators. But this infection is so severe that by the time you get to go on a ventilator, that you are already very seriously ill. And that's the reason why I believe you're seeing a very high death rate. There have been some reevaluation of that. Apparently, that is in some hospitals, but in others, the death rate is considerably lower than that 80%, but it's still unacceptably high. But that's because of the seriousness of the disease.
In addition, I have heard from some of my doctors, my friends, that there was a lot of doctors that did not know how to use the ventilators properly, and that probably caused some of the problems.
Yeah.
We have a minute. We have a minute left. Is there anything else you want to tell the American people?
Well, I do. I want to just continue to encourage us that we've been through a lot. This will end. It's not something that's going to go on forever. It will end by how we respond to it. We need to be responsible. Obviously, we all want to open up the country again and bring back some semblance of normality. We want to get the economy going. We've got to do that delicate balance between moving forward in a careful way, heeding the guidelines so that we don't do something precipitously, but continue to push ahead toward trying to get back to normal. At the same time, that will put all of our efforts into trying to contain and ultimately bring this outbreak down to a negligible level. Hopefully, we're in the right direction. I believe we are. We just need to keep pushing.
Dr. Anthony Fauci, the Director of Allergy and Infectious Diseases at the National Institute of Health, thank you so much for calling in this Sunday morning and bringing the American people up to date.
Good to be with you, John. Thank you for having me.
Thank you. This is the Cats Roundtable. We'll be right back.